Welcome back, guys. This is video number 3 of the Blood Gone Bad series. Okay, so last time we were talking about leukemia and we were talking about leukocyte issues. Now we're going to talk a little bit about lymphoid issues. I'm going to focus on 2 things. We're going to talk about Hodgkin's disease and non-Hodgkin's lymphoma. So first, let's talk about Hodgkin's. Okay. So first we're going to talk about Hodgkin's lymphoma. Some people call it Hodgkin's disease. This is a malignant lymphoma that typically will travel in a pattern from one lymph node to the other. The presence of what are called Reed-Steinberg cells is one of the hallmarks of Hodgkin's disease. This is malignantly transformed B cells. The structural changes that occur in those B cells lead to the presence of these Reed-Steinberg cells that have a very distinctive appearance when you look at them under the microscope. So some of the symptoms of Hodgkin's lymphoma or Hodgkin's disease, would be things like, because this malignancy tends to move from lymph node to lymph node, sometimes people will get an enlarged lymph node in their neck, for example, fever, chills, night sweats, itchy skin. So night sweats, many women will go through, when going through menopause, will experience as hot flashes and night sweats. So in cases like that, we wouldn't point night sweats out as an oddity, because it's something that's a known issue that's associated with going through menopause in many menopausal women. Someone who has night sweats and doesn't have any of that type of issue going on, it certainly becomes an alarming symptom. So night sweats means someone is sweating profusely through the night, oftentimes sweating through sheets to the point that their pajamas, mattress is damp, and it's occurring night upon night. In addition, someone with Hodgkin's would have leukocytosis. They're going to have an increase in their white blood cell count, but are still at risk for some infection because the cells that are being overproduced, and some of them, the line of them is ineffective. Okay, the treatment for Hodgkin's, and it actually has a fairly high remission rate, is chemo. It's typically radiation, sometimes in chemotherapy. Okay, so that's Hodgkin's. So again, it's speaking to a very specific lymphocyte. Okay, when someone has lymphoma, that's a little broader. It's a bit more common than Hodgkin's lymphoma. So this would be a progressive kind of clonal expansion of B cells in some cases, T cells in some cases, and in some very rare cases, the natural killer cells. Okay, so it can affect more than one cell type that are part of your lymphatic and obviously your white blood cells. Okay, so some of the signs and symptoms are very, very similar, to Hodgkin's disease in terms of the swollen lymph nodes. The pattern of swelling is going to be slightly different in a non-Hodgkin's patient. They don't have the presence of the Reed-Steinberg cells. They would still have a fever, night sweats, itchy skin, sometimes weight loss associated, just not feeling very good, but they have cytopenia. Which means they're going to have an overall decrease in the number of their blood cells. So the treatment for non-Hodgkin's lymphoma is dependent on the type. So typically we would use chemo. For lymphoma patients, you can also use something like a Rituxan, which is a different type of